Hey there VC-HHD students, my name's Andy, I'm a VC Health and Human Development teacher. In this short video we're going to look at answering the 2018 VC-HHD exam, question number 11. Before we dive into that, don't forget the Health Resources Hub YouTube channel has over 45 videos like this one available for you and other HHD exam students to check out, and there'll be a new one coming out each day between now and the HHD exam at the end of the year, so make sure you subscribe and tell your HHD friends to do so too to get access to all of those. I'm running the ACE Health and Human Development exam preparation sessions at the end of this year, and you can book a spot to those at book.acevce.com. There's our social media links there if you'd like to follow us for alerts to the new videos coming out each day, and also an email if you've got any questions or suggestions for videos you'd like me to work on. So you can see here from the 2018 exam, question number 11 was worth 10 marks, and it started with this short piece of stimulus material that mentioned that the AMAs, the Australian Medical Association, wanted the government to use tax policy to force up the prices of sugar-sweetened drinks to change behaviour. And for the AMA, taxing them is far from a single solution to the obesity or diabetes epidemics. So then the first question for 6 marks mentioned, using your knowledge of effective health promotion, including the Ottawa Charter for Health Promotion, explain why taxing soft drinks is not the only solution to addressing the obesity epidemic. And so they've kind of led you, okay, in this question here in the direction they want. So they're asking you to reference the Ottawa Charter for Health Promotion. So if you see that, I'd be thinking about the action areas of the Ottawa Charter and why taxing soft drinks is not the only solution to addressing the obesity epidemic. So if you think about the action areas, one of those is build healthy public policy. And so that you can link, okay, there to taxing soft drinks as an example of a potential government policy and approach, but this is not the only solution. So I'd then be thinking for this question here, how can I link, okay, to at least probably 3 out of the other 4, okay, action areas, something to do with addressing obesity, okay? And so you can see here that for 6 marks, only 2% of the state was able to achieve 4 marks in this question. And so you can see down there that it mentions some students provide a description of the action areas of the charter without linking those to obesity. So you can see they also provided in the examiner's report an example of a high scoring response. And so it started by mentioning that there's many factors or several factors that can contribute to addressing a health issue such as obesity, okay, and then linked into different action areas of the Ottawa Charter. So they talked about the broader determinants, okay, and talked about creating a supportive environment, so doing things like the government working towards changing environments in things like schools and workplaces by discouraging the presence of things like vending machines, okay, or machines with things like soft drinks and saturated foods and foods with fats in them. They also talked about strengthening community action, so bringing organisations together to work on a common goal like lowering sugar content. You can see each time that they've referenced, I guess, an action area, they've mentioned something specific that you could link to obesity, like foods with saturated fat in them, okay, foods with sugar content in them. They went on to talk about developing personal skills and talked about doing things like being able to cook, and they could mention things there potentially, you know, foods that are high in things like fiber, so like fruits and vegetables, which can help to reduce overeating and reducing obesity. So each time that you linked to one of those action areas, trying to give an example and linking that into obesity, okay, and so to get the 6 marks, mentioning that obviously there is many different approaches linking to those different action areas that could address obesity. So then for B, okay, they asked you to describe and justify 2 examples of social actions that could be taken to address the increasing rates of childhood obesity. So social actions is covered in Unit 4, but they've linked it in here, okay, to a condition, I guess, that you're probably more likely to have perhaps talked about in Unit 3, maybe when you're looking at nutrition, but obviously it is relevant to aspects of Unit 4 also. So you just had to mention, okay, 2 examples of social actions. So these were things that could be signing petitions, okay, volunteering for perhaps a non-government organisation that was focusing on childhood obesity. So you can see once again it's a question that wasn't answered particularly well, and so you had to make sure that, as the examiner's report said here, that your example was relevant to childhood obesity, not just broadly linked to obesity, so trying to be as specific as possible. So this example down here that they talked about in relation to signing online petitions was talking about advocating for increase in cost of sugary drinks or changes to advertising practices on television, okay, to reduce exposure of sugary drinks to children and adolescents, so linking that into childhood obesity. So just make sure that you always address those key aspects of the question there, and there's a couple of other samples in the examiner's report. Okay, hopefully you found that video useful. As a reminder, the Health Resources Hub YouTube channel has a whole heap of videos you can access there, so please subscribe. The ACE HHD exam preparation session I'm running in the upcoming break, and also social media links in our email. Thanks so much.